Finally, SSRIs. This is big, guys. From this chapter, they love to test you on SSRIs. There are different classes of antidepressants. You have your TCA, your mouse. I'm not saying they couldn't ask you any questions on any of these, but the main ones that tend to come up quite a lot are the most popular ones, which are your SSRIs. So I've put together a few slides to show you some of the key things about SSRIs you need to know. Number one, the common tested areas: citalopram, QT interval prolongation, escitalopram, QT interval prolongation, fluoxetine can be given to children. They will test you whether you know which SSRI should be given to children. Which one has the highest withdrawal rate? It is paroxetine. And then which is safe in angina or MI conditions? Sertraline. So this slide is very important. They have asked questions on this before. You need to know this stuff. So this is the first thing when it comes to SSRIs, what you need to know. You need to know side effects, you need to know this stuff. The next thing is a slide that I've tried to make it easy with the key points. So the first thing is with pregnancy and breastfeeding. They're going to test you to know whether you know which SSRIs you give to pregnant women, which ones are the safest when it comes to pregnancy, and then when it comes to breastfeeding. So the safest are your sertraline and paroxetine. When it comes to children, the SSRIs for choice, they're going to test you on this. It is fluoxetine. I mentioned this previously that you have hyponatremia with most of your CNS drugs. In this case, with your antidepressants, common side effect is hyponatremia, so increased risk of convulsions. So please learn this. This is the electrolyte that gets affected from your antidepressants, especially SSRIs. Know about the important side effects from SSRIs, GI side effects. They could increase the risk of bleeding, and this has come up in a few GPhC exam questions. So please learn this. SSRIs interacting with, say, NSAIDs. A patient is on paroxetine and has come to the pharmacy to buy an NSAID. You need to know about this interaction. It could increase the risk of bleeding. We spoke about hyponatremia. Can cause convulsions. So by decreasing the amount of sodium, that can increase the risk of getting a seizure. QT interval prolongation, another common area that gets tested with SSRIs, increased risk of bleeding and sexual dysfunction. Please learn this. This is a very, very important slide. And in your GPhC exam, we've had a number of questions from just this slide alone. The next slide is equally as important. Contraindications of SSRIs, the manic phase of bipolar, poorly controlled epilepsy, and QT interval prolongation. Any of these, you have to avoid SSRIs. Now, the interactions of SSRIs come up in your GPhC exam a lot, your GPhC exam a lot. Let's learn those side effects, those interactions, sorry. So this table is so important. There are many interactions, but these are the key ones. Know about the interactions with lithium. So lithium and SSRIs, amiodarone, all these drugs that can cause QT interval prolongation, such as your macrolides or antibiotics, you need to learn this. St. John's wort, serotonin syndrome. So certain drugs will increase the risk of serotonin syndrome when given with SSRIs, and St. John's wort is one of them, and you can get tested on this in the exam. Things like NSAIDs, aspirin, anticoagulants increase the risk of bleeding. We mentioned that SSRIs increase your risk of bleeding, GI bleed. Fluoxetine, paroxetine, or tamoxifen, they decrease the efficacy of SSRIs. And again, they do ask you a lot about which drugs cause serotonin syndrome with SSRIs, which are normally fentanyl, your triptans, tramadol, and we've mentioned another one up here, which is St. John's wort. So please learn these are the most important side effects that come up, most important interactions. Learn this and you'll be in a good place when it comes to SSRIs. I'll put another table, some more notes on here for important SSRI interactions. A bit of what I've mentioned previously. This is just a repeat and going into more detail. So increased bleeding, they may test you on GI bleeds. It has come up a few times in the exam. Please learn this stuff. Then you have phenytoin, increase the risk of sertraline toxicity, QT interval prolongation. So any drug that increases the risk of QT interval prolongation, given that with an SSRI, increases the risk as well. So these are the drugs, example of drugs that could increase or predispose a patient to QT interval prolongation. We did mention about hyponatremia. That's more common in SSRIs compared to the other antidepressants. So any drug that causes hyponatremia has to be avoided or cautioned, such as NSAIDs, diuretics, carbamazepine. We've mentioned about serotonin syndrome, tramadol, sumatriptan, ondansetron. These St. John's wort, again, this has been tested in the GPhC exam a few times. it will get tested again. But I put everything together for you to make your life so easy. Learn this and you will be in a very good place. So what is serotonin syndrome? So it is when you give too much serotonin. A common interaction they love to ask you is an SSRI with an SNRI. For example, venlafaxine is an SNRI. If you give two drugs that have a lot of serotonin, they will cause serotonin syndrome. So important. So you need to know which drugs cause serotonin syndrome, which are your triptans, tramadol, lithium, methadone, SSRIs, St. John's wort, citron, such as ondansetron. So this is really the most important things for you to learn when it comes to SSRIs. This is where the questions come up from in a lot of exams when it comes to SSRIs. Now you know, learn this and you will be in a good place. Again, these are GPhC exam predictions. We're not learning everything about SSRIs. I'm giving you the key foundations that you need to build on if you want to pass the GPhC exam. I look forward to seeing you in the next video.